Today is Tip Tuesday. Hey, what's up guys? My name is Antonio and this is Megan, and we work in physical therapy, and in this channel we talk about the ins and the outs when it comes to physical therapy. And in this video we want to give a quick 2-minute tip that can help you out in this field. Today we're talking about why do some patients do their home exercise program and others don't. I know a lot of clinicians that pawn it off on the patient and say that, oh, they just had a bad patient, some patients aren't compliant and some are. I actually think that there's a lot more that we can do as clinicians that's in our control to help the patients out.
So the tip is to take ownership. One of the things I would recommend is just understanding your patient better. So as you understand why they're not doing their home program, sometimes people think they don't have enough time, sometimes they think it's too complicated or too hard or it causes pain or something. Find out from them what it is that keeps them from following through.
So not only just understanding the patient, but then also using that information and actually applying it. So one way to do this is by giving one concise, simple activity for the patient to go home and perform. So if you give them a whole bunch of exercises, oftentimes they're not actually going to comply and do it. But if you give them one idea to focus on and take with them, then the chances of them doing it will be much higher.
One of the other strategies that you can use is, instead of giving the standard, hey, do this 2 to 3 times a day, 3 sets of 10 or something, have them do it throughout their day or have it make sense in their day. So maybe like every time you do dishes, I want you to try this at the counter, or if you're watching a show at night and there's a commercial or a break or something, try this during that time. So they're doing something and it just is more natural than setting apart that time to exercise, which no one likes.
When you get to know the patient's personality and their interests, then you can understand what would be the best way to help them with their HEP. So some people like a concrete answer and they like the drill sergeant, like, tell me what to do because you're the therapist. Or some other patients sometimes like a little more leeway, so maybe giving them options, like maybe say you can do this instead of this. That way that they'll feel like they're in control of their own situation.
So the tip for today was take ownership. So instead of writing the patient off if they don't do their home program, finding ways to connect with them so that you can help them meet their goals.
Awesome. Peace.